Welcome back to Phil's Gang Radio Show. For more information, simply go to philsgang.com. Now, here's Phil.
The president's lying through his teeth, and by the way, he also used the politician's F word, free, claiming that the preventive care that people are getting through their insurance policies is free. Actually, they're paying for it up front in their premiums.
And that's Dr. Betsy McCaughey, the former Lieutenant Governor of New York, and my guest, Lieutenant Governor. You there?
It's very nice to be with you today.
Thank you. Love what you're doing. I love it. I love how you come out and just whack these guys. Go ahead. The one question I had, we were talking about the. I'll let you take it. This thing drove me nuts when Valerie Jarrett came out. So, this is just a little delay. It's not going to cost us much. Unbelievable.
Well, it is shocking because it was portrayed by the administration when they quietly leaked this information. It was far from an announcement when they quietly unveiled the fact that they were not going to be implementing the so-called employer mandate. They portrayed it as a mere tweaking, but in fact, delaying this mandate will affect as many as 10 million workers who are currently uninsured or underinsured and whose employers would be impacted by the mandate. It could double the number of enrollees in the health insurance exchanges this October, because not only will certain employees be going to the exchanges, but their dependents will be eligible for subsidies on the exchanges too. And here's the really amazing, staggering fact. It could cost the taxpayers of this country an additional as much as $62 billion. And yet the administration, with a snap of its fingers, said, we're going to do this. They don't have the legal authority to do it. The president does not have the authority to change the law. And yet, there they go, acting like dictators again.
Unbelievable. Charlie Rango, what was he spouting off about? Preventive care is free under Obamacare?
That is ridiculous.
Unbelievable.
Everybody knows there's no tooth fairy, but unfortunately there are too many politicians in Washington who actually play us for fools, who think the American people are stupid. So stupid that they aren't smart enough to pick their own kind of health plan, so stupid that they think something is free just because you're forced to pay for it up front in your premium instead of when you go to the doctor and actually choose to get the service. Let me tell you, I think that being forced to pay for a colonoscopy feels almost as bad as getting one.
You're so right. Oh, God, that's cool. Explain.
Let me give you a few pointers, because the reason I wrote this book, Beating Obamacare.
Right, I was just going to mention that.
Yes, is that here is a guide to what you can expect over the next 18 months. If you have this information, you can avoid some of the real landmines. For example, I say most of us confide things to our doctor we wouldn't tell anybody else. Mm-hmm. And yet, under this new Obama health law, your doctor is going to be required to enter your medical history and your medical treatments into this electronic database that is envisioned as being part of one nationwide database with every patient having a page. So I say, this is the time to talk with your doctor about keeping 2 sets of books and saying, look, doc, there are certain things I don't want you to put in that electronic database because it's going to be seen by thousands of eyes.
Oh, absolutely. And this book, Beating Obamacare, is your handbook for the new health care law. It's a great book, and you've got to get this book. Explain to, most people, you talked about health care, they don't understand. Tell them in simple terms.
Well, they do. In fact, people are a lot smarter than the politicians assume.
Oh, absolutely. But tell them in simple language, how does really going to affect, one, the seniors, and how's it going to affect the young people?
Well, seniors get clobbered the worst.
Oh, big time.
Oh, yeah.
Right.
Over half this law is paid for with cuts
to
Medicare. Can you imagine? Over half. So, and it's going to affect everybody, not just seniors. For example, hospitals are going to be paid $247 billion less by Medicare over the next decade. And that's going to affect everybody. In fact, if you're going to the hospital and you know that you have to go, you're going to have an elective procedure done like a knee replacement or hip repair, try to cobble together enough money so that you can pay for a private duty nurse at least the first night, because hospitals are already laying off nurses. They're already spreading the nursing care thinner because of these cuts, and that means that if you need help, if you need pain control, you're going to push that button and then wait a lot longer than in the past.
And the quality, how's this going to affect the quality of our doctors? Who's going to want to be a doctor? This is my point.
Well, one of the worst things is if you're a baby boomer, if you're in your 50s or early 60s, line up your doctors now, your cardiologist, your internist, even if you're healthy. Because if you wait till you turn 65 and go on Medicare, you will not be able to find a doctor willing to take you on as a new patient.
Wow. This is just a mess. So what is we got 1 minute left. What's the actual cost in this thing for a person, for a family? They're talking $15,000, they're talking $20,000. What is the actual cost per family?
Well, as you can see, it depends a little bit on where you live, but we know that health premiums for individual coverage are 51% higher in California now than they were last year. The Ohio Insurance Department has announced that individual coverage will be 82% higher than it was last year. So if you are affected by this and you have to go on one of these health insurance exchanges because your employer doesn't provide coverage or has just dropped it, and you're hearing about that all over the country, employers dropping coverage or pushing people down to part-time status, you're going to be paying many thousands of dollars even after the subsidies that are available on the exchange. And for that, you're going to get, the cheapest plan has a $5,000 deductible. So you're going to still be paying a hefty amount every time you go to the doctor. In fact, when I was looking at the California plans the other day, and I think Florida's going to be very similar, the copay for going to an emergency room was $600.
Unbelievable. Listen, again, we got it. We got to get you back. This was terrific, and we'll
so enjoy it.
Thank you. We got to get you back to talk about immigration.
Will do.
Okay, thank you. We'll be right back.
Want more information on this show? Go to philsgang.com or give them a call at 877-600-GANG.